Let's get into something we've come to thoroughly enjoy over the past few weeks, and that's something we call What's Up, Doc, where we spend some time with some doctors from Mercy Health, and they tell us some things, we learn some things, we ask them some questions, and we all walk out of here better educated. Well, except for the doctor.
Definitely except for the doctor.
The doctor's educated, and maybe I don't want to sit in with those guys anymore. Well, this morning we are going to spend some time with Dr. Jillian Kaskavage, who's a pediatrician at Mercy Health. Dr. Kaskavage, good morning.
Good morning.
How are you this morning?
I'm great. How are you?
We have nothing to complain about, do we?
Not yet. Well, I do, but it's not for on air.
It's not for a pediatrician.
Right.
It is not for a pediatrician. Okay. Tell us a little bit about you.
Well, I'm a local to the area. I was born and raised in Oregon, Illinois, and did my medical school here in the Rockford area. Went away for...
Riley also born and raised in Oregon.
Yeah, just a little bit probably older. Class of 1981, Oregon High School.
Yeah, I was class of 2004.
Okay, a little bit of a difference there.
Yeah.
So, please continue. We interrupted, talking alma maters.
That's me.
Oh, yeah, no worries. So, yeah, I graduated residency in 2015, so I've been back. I moved back here back when we were Rockford Health Systems and then merged into Mercy Health. So I've been practicing primary care pediatrics for the last 5 years, mostly doing outpatient clinic, and also serve as the medical director for the Walter Lawson Children's Home.
Outstanding. What drew you to pediatrics?
Well, I just really loved working with kids and seeing how resilient kids are. They can be, terribly sick one day and then bounce back. And they're just a lot of fun to be around. You always get a kick out of things that come out of their mouth when you're not expecting. So it's a really worthwhile and rewarding experience.
And I've always thought it takes a special person to become a doctor, period, someone involved in the medical field. But to deal with kids and, dealing with their parents at the same time takes a special sort of person.
Right. Absolutely. Totally agree. I just became a parent myself here in the midst of this pandemic in April. I gave birth to my son, so I have a whole new appreciation for the struggles of parenthood.
So would you consider it to be normal then when you take your baby in for their first set of shots that mom or dad tries to shove their hand in front of the needle so you won't stick the kid?
Yeah, I just feel a little bit of that anxiety myself. Even knowing, all the pros and all the benefits to vaccinating, you still have that little bit of apprehension. This is a shot going into my poor innocent baby, but we know that it's really best in the long term to keep your kids vaccinated and up to date. So. And
do you recommend a trip for ice cream immediately after, whenever your kid gets a shot? Because that's what we did with our two.
Absolutely.
Okay.
Yeah, what's the sucker situation in your room? You have treats, right?
Yeah, we usually keep suckers. Now, because of the pandemic, we're kind of keeping them locked away so we don't have hands digging through them to find the best one. But
right.
So handy.
You know what brand you're using? You Dum-Dums, the safety pops, blow pops?
It's safe pops, yeah. And then advising them to brush their teeth right away, of course.
Outstanding. Okay, so the experience remains the same. It's like it's supposed to.
Right.
Like it's supposed to. It's weird when your kids get into their 20s and they go get a shot and come home and go, aren't you going to take me out for ice cream? Because that's what we always did.
Where's the safety pop, Dan?
Right. I need to get that. Yes. All right. Well, big question that parents are asking, doctor, is how to get students back to school safely during COVID-19. Kids learn best when they're in school. Coming back to school in person needs some careful steps in place to keep students and staff safe. So what are we doing? Kids go back to school, online, in person, a hybrid. What precautions should kids be taking, or more importantly, their parents be taking?
Yeah, absolutely. So the American Academy of Pediatrics does support kids going back to in-person learning as safely as possible. So for kids going to in-person school, they really need to follow the rules regarding mask wearing and social distancing. They should really be practicing frequent hand washing and avoiding touching their face as much as possible. So this also applies when they're out in the community, if they're indoors at grocery stores or restaurants, things like that. And kids should really be avoiding large gatherings outside of their school day, especially indoors where social distancing isn't feasible. I've also been recommending, if they live with or frequently visit a high-risk person, for instance, say like a grandparent with diabetes or cancer, they really should abide by these practices and may even consider doing remote learning just to keep that individual at lower risk of exposure. For parents with young children or children with sensory difficulties who have trouble tolerating mask wearing, I've been encouraging parents really to practice with them at home, starting with several short sessions of just, a minute or two and gradually increasing the time wearing a mask while they're doing something that they would typically find enjoyable, like reading a book or watching a favorite show or playing a favorite game, just to help build up the child's tolerance to mask wearing, because it really is going to be important. Like I've told parents, this is kind of the new normal, and coronavirus isn't going away anytime soon, so we really need to get kids learning to tolerate mask wearing and becoming adaptable.
Yeah, I was just going to ask you about that. Honestly, you're probably pretty good at coercing kids and getting them to do things that they might not be that excited to do. Wearing masks, that's one of the biggest things we heard, that try to get a 6-year-old to wear a mask all day. That could be tough,
unless it's Spider-Man or something along those lines.
Right. So, any other tricks besides just incremental? Is that the best way to do it? Just 2 minutes here, then we make it 5 minutes, then we make it 10. Is that the best way to get them used to it at least?
Yeah. Whatever you can do to kind of bribe them, make it fun, make it a game. Certainly find a mask that's comfortable for them too, to be able to wear for long periods of time. If it's really pulling on their ears or rubbing behind their ears, you also want to have a mask that they can take on and off themselves and aren't requiring assistance for that, because then again, that increases risk of contact and exposure with another care provider in the school setting. But yeah, whatever you can do to encourage it. I find that kids are very, very resilient. I have 2 nephews and a niece that are in kindergarten, 1st and 2nd grade, and you wouldn't believe that first day of school, all the kids are wearing their masks, just with that peer influence. When they're all together, all the kids are doing it. They really rise to the occasion, and if you have faith in them, I think that they are very capable of doing it.
And I think you make a wonderful point, too, on the fact that it's got to be something that's comfortable, because, kids are like adults in that, come on, this hurts. This is irritating my ears. This hurts on my face. This feels weird. I'm going to pull this thing off the first time you're not looking at me.
Absolutely.
And as an adult with no children, I don't usually look for kid-size things. Are there children's masks out there special for them?
Yeah, absolutely. There's tons of them if you just search on the internet, and even a lot of the retailers like Old Navy, Target, things like that. You can find children's style masks, with fun patterns. Crayola has masks out there as well too. So different styles to fit different kids' needs. So there's plenty of options out there.
Hey, if you're just popping in, we're spending some time with Dr. Jillian Kaskavage. She's a pediatrician with Mercy Health, talking a little bit about COVID-19 and kids. And speaking of, how does COVID-19 affect children differently? Symptoms different, reaction different? How do you look at it as a parent?
Yeah, so from what we know so far about the virus, children are less likely to get infected, and when they do, their symptoms seem to be less severe than adults. The symptoms in children still tend to be flu-like, similar to adults, meaning fever, cough, runny nose, sore throat, headache, body aches, and diarrhea. However, children can have very mild symptoms. They may only have a few on that list or none at all, which can make it really challenging to diagnose. Also, children with other health issues may be at increased risk of severe illness. So those are kids with compromised immune systems, some underlying heart or lung problems, and in particular, children with intellectual and developmental disabilities. So these children are in an even more difficult position when it comes to making the decision to go back to school, because typically they receive therapy services, physical therapy, occupational therapy, speech in the school setting. And then if they can't safely wear masks due to their physical impairments, then they're even more vulnerable to the virus. In addition to the direct health effects of the COVID virus on kids, we're seeing a lot of indirect health consequences as well, too. Because of the quarantine, we've seen a lot of children gaining an excessive amount of weight due to inactivity and their dietary habits over the summer. So a lot of bored eating and frequent snacking while they're at home.
I do that, too.
Also, the isolation has taken a significant toll on the mental health of our kids and teens, too. We're seeing increased rates of depression and anxiety in those age groups. And sadly, despite decreased rates of reporting of child abuse, we know that it is occurring, and likely occurring more so due to the stresses placed on families during the crisis. But children aren't around other caregivers like teachers and extended family members that would typically report the abuse.
I think a lot of people have said that getting especially the young kids back to schools is very important, not just for learning, but the social aspect of them being around other kids. A big social aspect of elementary school is recess and playtime. What kind of social distancing, if you were in charge of a school, what kind of social distancing would you enforce for playtime for the kids?
Right. That's, I think, the most challenging part for kids that age to really grasp maintaining their distance. So, I mean, of course, when you're outside, if it's a sunny day, a windy day, a breeze is blowing, it decreases the chance of exposure, certainly. But really for recess and playtime, trying to make sure that kids have their own equipment that's not shared. So thinking about those shared surfaces. Of course, we want them using the playground equipment. So then if they're having to do that, reminding them not to touch their face, taking masks off if it's feasible for them, if they can maintain social distancing. But yeah, again, that's just a really, really hard thing to manage. That's why I've been really pushing with families, at least be consistent with mask wearing, hand washing, avoiding touching your face, because those are things that they can exhibit more control over.
Doctor, you've been really, really generous with your time. Before we let you go, just one final question. What do you say to parents out there who know intellectually I should get my kid in? We should get a checkup. We should get vaccines. We should be up to date. But I'm afraid. I'm afraid to take my kid into that sort of setting.
Right, and that's totally understandable. We are taking precautions as much as we can. We're trying to get all of our healthy children in for their physicals in the morning and keeping our sick patients coming in the afternoon, not keeping our waiting room full, really moving kids back to private rooms right away. And it is really important to do in-person visits. So again, we can discuss these issues, review their child's growth, review mental health and how things are going with them at home, how they're handling this pandemic. And then, of course, getting them up to date on their vaccines. Certainly we don't want to get a repeat of last summer with outbreaks of measles cases in parts of the country, in addition to dealing with COVID and then, potentially influenza season coming up as well, too. So it is really, really important that they get in to see their pediatricians, knowing that we are taking as many precautions as possible, because we ourselves as healthcare providers don't want to increase our risk of getting sick either. So we're doing the best we can to keep our families and our kids safe and healthy.
Outstanding. Dr. Kaskavage, thanks a lot for taking time out of your busy day for us. This was very enlightening, and we really appreciate your time.
Absolutely. Thanks for having me.
Have a great day. That's Dr. Jillian Kaskavage, pediatrician with Mercy Health.